Has this ever happened to you? Hey there, Gauchos! My name is Housemate Safety Harry, and today I'm going to be sharing with you a few tips and tricks to keep your roommates safe if they encounter any emergency situations.
Who are you?
Now let's rewind. It is important to be cautious of your environment and understand that bugs live inside and outside of our homes. To deal with a bee sting, first remove the stinger if it's still in the wound. Use a credit card or a similarly thin, stiff object to gently remove the stinger. If the venom sac at the end of the stinger is unpunctured, do not puncture it. Next, monitor the victim for a possible allergic reaction. Ask them, have you ever been stung by a bee before? And when was the last time you were stung? If they do not know if they are allergic, monitor them for signs of a reaction, such as difficulty breathing, a weak or rapid pulse, nausea/vomiting, or changes in the level of consciousness. If they are experiencing any of these symptoms or have said that they are allergic, call 911. It's always a good idea to have a first aid kit on hand in case of an emergency. We recommend including bandages, clean gauze, medical tape, antibacterial soap, alcohol wipes, and healing ointment. It is also a good idea to have a few ice packs in your freezer. Can you guess the 3 types of burns? If you guessed thermal, electrical, and chemical burns, you were right. Burns can be further classified into 3 different categories based on their severity: first, second, and third degree burns. First degree burns only affect the outer layer of skin and are generally not considered to be severe. If you get a first degree burn, your skin will be red and painful but won't have any blisters. Second degree burns are slightly more severe and usually result in the skin that is red, shiny, and may look wet, as well as having blisters. It may also hurt to touch. Thermal burns are the most common type of burn, especially while cooking. For first or second degree thermal burns, immediately remove the victim from the source of the burn and then rinse off the area with cool running water. Keep the wound clean and apply over-the-counter burn cream to help heal the wound. For third degree burns, you will also remove the victim from the source of the burn and run cool water over the area, but you will also need to call 911 immediately. Be sure to monitor for shock and hypothermia, especially when cooling a large area where nerves may be exposed. In addition to those steps, for a chemical burn, wipe off the chemical with a dry cloth before rinsing to avoid spreading the chemical further. Remember to always be mindful for your own safety and call 911 if you are unsure about the severity of the burn.
Who are you talking to?
Now let's discuss what to do in the case of a minor cut. First, clean off the cut and local area with clean, fresh water. Then you need to control the bleeding. If you have clean gauze available, have the victim press firmly against the wound with the clean gauze. Then use more gauze to secure the gauze covering the wound by wrapping it around the body where the cut occurred multiple times, and then tie a knot directly above the wound for added pressure. You want this to be tight, but not so tight that it cuts off the victim's circulation. Ask them, does it feel comfortable? And if it's on an arm or a leg, can you wiggle your fingers or toes? You also want to check the person's capillary refill below the bandage. Do this by pressing on their skin or nail bed, which should turn white, and see how long it takes for the spot to regain color. If it takes more than 2 seconds, the bandage is likely too tight. For more serious bleeding that cannot be controlled, call 911 immediately. Let's give them another shot.